Advancing from a student to a professional nursing role is not a fairly easy process. With increased expectations regarding ability to transfer and critically apply skills in the profession, the question of nursing students' preparedness remains. Good day, fellow researchers, the College of Nursing, and the University of St. La Salle community. We are Group 1A of VSN 3C, presenting to you today our research entitled Graduating Nursing Students' Perceived Preparedness for Clinical Practice in Special Areas. I'm Andrea Paula Alisen, and alongside me are Lea Erica Abastillas, Gian Aguelo, Lawrence Deivin Arsuento, and Cassandra Janelle Baterna. Transition from student to employee within the nursing field can be an intimidating process of role transition. Despite knowledge of this transition, final year nursing students still report difficulty in translating acquired learning into clinical practice, expressing sentiments of being inadequately prepared for the demands of healthcare settings. This inadequacy is prompted by the gap between theory and practice. Therefore, the purpose of this study is to delve deeper on the different perceptions and sentiments of the graduating nursing students towards preparedness in entering the clinical practice or nursing workforce, especially the particular influence of the COVID-19 pandemic and the abrupt shift to online learning towards their confidence in their clinical skills and knowledge. This study may serve as a guide towards improved means of better preparing student nurses in their journey to clinical practice.
Since our study is a qualitative research, we have one general objective, which is this study aimed to explore the graduating nursing students' perceived preparedness for clinical practice.
In order to offer clear descriptions of experiences and perspectives of the participants, this study utilized a descriptive qualitative research design in order to effectively study human perceptions and interpret such views with more understanding. An in-depth interview was done by utilizing an interview guide in order to collect the data.
An interview guide with essential questions guided with the aim of the study was utilized as an instrument. The interview guide was divided into two parts. The first portion is regarding the demographic data, consisting of their sex, age, section, hourly general weighted average, and number of exposure. The second portion includes the essential question, which states, "Tell me your thoughts on how prepared you are to enter the nursing workforce with the current proficiency."
This research study utilized a non-probability purposive sampling in selecting the participants, wherein 7 participants were chosen based on the inclusion criteria established. Participants of the study are 7 Level 4 nursing students from a local university in Negros Occidental. The inclusion criteria are the following. First, either male or female nursing students. Second, belong to the age of 19 years old and above. Belong to either section A, B, C, D, E, F, or G. Students with either an excellent, satisfactory, or average general weighted average for NCM 118AR. Students with at least 3 exposures to special areas, specifically the delivery room, operating room, and intensive care unit, and are currently enrolled as 4th-year nursing students of the university.
For the results and discussion, beginning from the first theme, New Normal, Negative Changes Brought by the Pandemic, the statements gathered illustrate how the transition to online medium resulted in bad learning outcomes, leaving students less knowledgeable and dissatisfied with the learning modality. It also influenced their clinical placements, with many being cancelled or postponed, creating delays in their training and falling behind in the number of exposures.
For the second theme, the abrupt shift difficulties during online class, a fair few participants shared their sentiments about the challenges they had faced during the course of online learning. The lack of clinical exposure leads to decrease in academic completion and skills development over time. That causes the graduating student nurses to reassess their preparedness as they mark their last year in the university.
For the third theme, Guiding Hand, Critical Role of Clinical Instructors, Physical Presence. The participants' statements show that the presence and guidance of the clinical instructors gives encouragement to the students to fully execute the procedures in the clinical setting. Instructors are effective at guiding nursing students into the nursing profession by improving their competence and confidence.
For the fourth theme, Build and Sharpen Need for Knowledge and Skills Improvement, the participants' and others' point of view indicates the importance of continuous learning and exposure to sharpen and build knowledge and skills for improvement. Also, participants indicated how important refreshers and practice will enhance their acquired knowledge and skills.
The fifth theme, Missed Opportunity, Lasting Impact of Decreased Exposures, exhibits the participants' responses on the impact of decreased exposures towards their perceived preparedness. Participants share that there is a dire need for more experiences in clinical areas, stating that absence of real-time practice caused them to perceive themselves as unprepared and lack skills on par to their current level, contributing to their lack of confidence and inability to develop clinical reasoning, especially when introduced to special areas.
For the last theme, Ready or Not, Optimistic Perception and Clinical Preparedness, the participants shared close sentiments as they assumed that, in some way, they were ready to face the actual clinical setting and shared the same characteristics of not being that confident. Also, participants shared that they had acquired learning and mastery from their limited experiences and exposure in the special areas. Despite lacking experiences on clinical grounds, the participants showed resilience and trust in their learning despite the hindrances they faced during the pandemic and the online setting.
The impact of limited physical exposures and the emergence of online learning did not greatly impact the perceived preparedness of the graduating nursing students for clinical practice in special areas. Students are prepared, but have wavering confidence in their knowledge and skills. In the simplest words, they are almost ready. Participants expressed that they are prepared to an extent, but still need more experience in the clinical setting to further feel ready to perform their responsibilities in their first nursing jobs. The tenacity and passion of the nursing students to overcome this is truly admirable, and despite sentiments of not being fully prepared, undeniably, these students are ready to face any situation.
The following are the recommendations formulated by the researchers for nursing school administrators should take into account and respond to students' requests, taking action on increasing teacher-to-student communication for students to feel valued. For nursing educators should think about reducing students' workloads and giving clear instructions for each activity to generate a more holistic learning experience for themselves and their students. For nursing students are advised to find answers to specific problems and should be addressed immediately to avoid it becoming a complex problem. And lastly, for future researchers may seek to recruit significantly more potential case studies so that they have a larger choice of which to pursue once the study begins, allowing for a more in-depth approach.
To access the study's references, you may scan the QR code on our poster. That will conclude the presentation of our study, Graduating Nursing Students' Perceived Preparedness for Clinical Practice in Special Areas. Once again, good day and thank you for watching.